one of the major concerns we have are the increase on deaths, self-harm, and suicides. Are we providing adequate mental health services to the inmates that we identify on suicide watch or with mental health concerns?
I'll turn to the commissioner first, and then we'll ask correctional health.
I think we have an adequate complement of mental health staff. I think the bigger problem is the number of COs available to work with them and to bring people to their appointments. I actually think CHS does really terrific work, and they are reasonably well staffed. But I don't know,
Thank you,
what you think?
Commissioner. Yes, I agree. It's less of an issue of CHS resources or staffing as it is an issue of having corrections officers who can provide access for our patients and, in order to deliver timely care.
One of the things we went and visited a couple of weeks ago with you. One of the things is on intake, are you guys able to identify people that may have special mental health needs and to be able to provide those relative services?
Yes, we do conduct a medical screening, and then we make referrals to the mental health service, which can include substance use. And just to go back to the chair's initial statement, I should note that everyone with medical or mental health or substance use issues doesn't need to be hospitalized. We do have robust services under normal circumstances for patients in the jails.
One of the major concerns that we also had was watching the intake process when new folks are coming in and watching and abiding by COVID protocols and watching to see the population and how many people are in a holding pen or a cell or what have you. What have you been doing to ameliorate this issue?
Yeah, so what you saw was crazy and very bad for COVID, period. And so now that facility, that intake facility you saw is closed. We've got a new intake facility. Everybody's going through in less than 24 hours, generally well less than 24 hours. So they're not sort of stopping up the way that you saw them and just hanging out there and transmitting. And then they go right through the medical and mental health screening, and then they get cohorted for either 10 or 14 days, depending on if they test or if they refuse to test, and then, and only then, that they get sent to other parts of the system.
Yes, this was a recommendation of correctional health to open up a new intake facility, which is much bigger than the one you saw, as well as 2 clinics that are tied to it, where the one you saw literally only had 1 clinic and much smaller. So there's much better spacing, the timing is much better, no question, that should not have happened, and now it's not happening. Again, do we have more to do? Yes, but we hopefully have addressed that, but we still need to make improvements even on what we have now.
Another issue that we were looking at was the use of technology or use of processes to measure, for example, the amount to be able to measure the different aspects of where people needed, for example, when we talk about self-harm, do we know what methods people are using? Are we measuring that? Are we quantifying that? And are we addressing that properly?
We do track self-injurious behavior. I can try to find you the more specific data on methodology.
So, yes, we're very concerned about making sure that people aren't, that we're tracking or making sure that we are addressing people that are using certain methods more so that we could address that. We're very concerned that, the level of increase of, as I stated, death, self-harm, and suicides that's happening at Rikers, and we have to address that head on.
Yeah, I agree, and we know that the jail environment is a high-stress environment for our patients, and with COVID and other conditions in the jails, it has created a more dire situation that we're working with the department to address.
All right, thank you. That's my time.